5:23 on LBC. Not so long ago, we took time in the show every Friday to examine the latest COVID statistics. It's been a while, but as we always say, COVID has not gone away, far from it. Today's figures from the Office for National Statistics show the number of people in the UK with COVID, this is an estimate, has risen by 32% to almost 2.3 million. That's up about 500,000 in the space of a week, the highest estimated total for infections since April. Let's catch up with two of the experts who've helped us through COVID to date. Dr. Bharat Pankhania, Senior Clinical Lecturer in Public Health Medicine at Exeter Medical School, and Linda Bauld, Professor of Public Health at the University of Edinburgh. You're both very welcome. Professor Bauld first. What do you make of the figures? Welcome back.
Thanks, Eddie. I mean, obviously, we don't want to have these levels of infection in the community. And what is driving this rise at the moment is we've been dealing with the Omicron variant since the end of the last year, beginning of this year, but it has a number of sublineages. And BA4 and 5, which seem to be on the rise, have a growth advantage. That means that it can be passed on more easily. And secondly, we're seeing quite a lot of reinfections. So people are picking it up again. So that's worrying. I don't think it's a cause for panic. The vaccines are still effective and working, but it's not where we want it to be.
And in it being easier to pass on, how should that influence our behaviour?
Well, I think the media is covering this extensively today, and for me, that's a good thing. There's a lot of people who are more vulnerable and think that nobody's speaking about this, and it's still with us. So I think in terms of our behaviour, when you see these high levels of infection in the community, and we still have the ONS infection survey, even though we're not testing the same numbers, do modify your behaviour. Do put that face covering back on in enclosed, busy public places. Think about hand and respiratory hygiene. We don't have to stop doing the activities that we love, but just be a bit more cautious. We don't want to pick it up and we don't want to pass it on to others. I think that's the key message.
Dr. Bharat Pankhania, welcome back to you. What do you make of the numbers, first of all?
Well, it just shows that what happened in the United States has followed in the United Kingdom. A couple of weeks ago, it was 1 in 40 persons infected. Now it's 1 in 30. So the numbers are up. And just to add to what Linda was saying, is you don't want these repeated infections, because we've got evidence gathering now that repeated infections can go on to cause other harm, i.e. act as a super antigen, meaning, trigger a autoimmune response that after the infection has gone, you may go on to have kidney, heart damage, blood vessels, etc. So you need to keep your guard up, not keep on getting infected.
And Dr. Pankhania, what do you think the public health response to this should be?
We need to keep that messaging up. We don't want people to be restricted and not do anything over the summer. So in crowded places, wear a mask, but wear a good quality mask. And indoor places which are poorly ventilated, ask for them to be better ventilated, or don't go inside. And then one more really important thing as summer holidays start, if you are traveling on those crowded buses, tubes, trains, aeroplanes, look, for your journey, for the duration of your journey, it's not that onerous. Please take with you a good quality mask and wear it properly.
Professor Bauld, is it a moment for those public health messages, and we're familiar with how they were conveyed previously, should they be restarted?
Well, we've never actually stopped. I mean, some of them are still there online in social media. Certainly here in government, we still have a campaign that's running. Sorry, here in Scotland, we have a campaign that's still running. So, of course, we need to keep giving those messages. And another message we need to give is the spring booster program has gone well, but we've still got about 16% of people over the age of 75 who've not come forward for that additional dose. So for me, the really important public health messaging is not about just the behaviours and the environments, including ventilation, but also about the need to continue to have people come forward for vaccination. And of course, we'll be looking to another round of vaccines in the autumn. So I think the point you made, Eddie, about and also, Barrett, about not giving up on doing the things we love. Absolutely. We're not back in 2020 again, but we should still be talking about it and reminding people that there are simple things we can all do.
And on that question of vaccinations, Professor, Caroline texts to say, are the vaccines wearing off?
Well, they're certainly wearing off against infection. Your protection against infection, these are not sterilizing vaccines, wanes very quickly after you've had a dose. But the protection against severe disease is still holding up well. In those who are much older and perhaps immunocompromised or immunosuppressed, we know there are challenges there. But for many people, the waning against severe disease is not significant. So we should have confidence in the vaccine program. But when we're asked to come forward again, particularly as we head into the winter, those of us that are eligible really must do that.
And Dr. Pancagno, how would you like the vaccine programme this autumn and winter to take shape? Who do you think should be coming forward for vaccinations?
Well, I would start with the at-risk groups. And so the at-risk groups are obviously the elderly, the immune suppressed. But in addition, healthcare workers and blue light services, those essential workers, because if you want to keep things going, you also need to immunize and protect them. So the other people may be in the not so high risk group. We don't want them to be infected. But one more thing, Eddie, I wanted to say is I think it is now time to reformulate the vaccines, because the vaccines were formulated against the Wuhan strain, which has long come and gone. And whilst the vaccines are working, I think it's now time to reformulate it against the Omicron variants that are in circulation. And hopefully they will continue to provide enhanced protection against the infections that we are seeing.
So many people, of course, the vast majority of people got vaccines. What would you say to a sort of repeat of that? Everybody who wants one can get one.
Well, no harm done, really. And the vaccines save lives. And, we know that we've been immunizing people for decades and it saves lives. And the same applies here with the SARS-CoV-2 vaccines. They have been a big game changer, and do take it. It will protect you, save your life.
And Professor Bauld, finally, we've had a tweet asking about free testing, and we know all about that. What do you say, given where we are now, what about free testing being more readily available again?
Well, we must remember people are still eligible in certain groups if they are particularly at risk. They may be eligible for treatments. People can still get testing. And of course, we are still regularly testing that huge workforce that are coming into contact with patients, health and social care workers. But testing regularly for the rest of us, if we had a money tree, Eddie, if there was an endless public purse, of course, I would like free asymptomatic testing to continue to be widely available. But we don't. We have a cost of living crisis. We have an NHS under strain. We have lots of things governments need to spend money on. So it really is a political decision, but I can understand why that couldn't continue indefinitely.
Thank you both. Very grateful to you. That's Linda Bauld, Professor of Public Health at the University of Edinburgh, and Dr. Bharat Pancagno, Senior Clinical Lecturer in Public Health Medicine at Exeter Medical School.